All right, welcome back. We're continuing our coverage of Men's Health Month, and this morning we're talking about mental health. Our guest today, Geoffrey Ball, Program Director for the Harris Center for Mental Health and IDD. Mr. Geoffrey, how you doing? Welcome back.
I'm good. Thanks for having me.
I love this topic. It's an important one.
Very important.
Let's get right to it. Right off the top, why do you think there is still such a strong stigma around mental health and men?
Men are always thought to be strong, stoic, self-sufficient, and that keeps them from wanting to actually involve themselves in mental health because they feel like it makes them seem weak.
Right.
And that's not really the truth.
And that's where it begins.
Yes.
I was telling you in the commercial break, I was having a recent conversation with a friend of mine, and the topic was, as men, as dads really, and as husbands, that we should suffer in silence. And I had an issue with the way he phrased it, but I understood what he was saying, which is, as the dad, as the father, as the husband, we need to be strong and we need to show that strength to our family members. So therefore, when we're feeling down, we can't let anybody know, hence suffering in silence. What do you think about that?
Well, I mean, being that strength as a man, it's true. We have to be that strength for our family. We have to be strong. We have to be that backbone. But if you alter the backbone, you alter the mind. And once the mind becomes altered with this mental health disorder, because you're not speaking, you're suffering in silence, your emotions are not being met or heard, you have to reach out to someone that you trust, a loved one. Yeah, that you may not want to put that burden on your loved one, but at the same time, you have to talk to someone that you trust so that person doesn't judge you while you go through what you're going through with your mental health.
I feel like it is a fine line between we're feeling weak or we're feeling like we're complaining versus, you know, this is an actual issue that we need to talk to somebody about, and not knowing the difference. It's so hard for me to know what I'm feeling and whether it's right or wrong.
Right.
So what do we do about that?
When you don't, and it's hard, when things change within you, it's hard to know if it's right or wrong, how do I discuss it or who I go to. But when you seek help from someone that you actually love, that's not going to judge you, they will tell you the truth.
Yeah.
And the truth, like they say, will set you free.
Indeed. And I know at the Harris Center, you guys have a lot of these resources. So
we do.
If it's somebody close to me, is it okay to reach out to a best friend or a family member in the meantime?
Yes, reach out to a friend, family member. Ask them, has my behavior changed? How can I seek help? Can you help me cope with my issues that I'm going through? Yeah. And at the Harris Center, we have plenty programs. We have clinics, 4 clinics that you can go to. If you're suffering from suicidal or homicidal ideation, call 988. If you just want to seek help for a crisis or where to go or how to seek help for your mental health disorders through any of our programs, call 713-970-7000. We'll get you the help you need.
And what are those different programs? I mean, are we addressing not just the mental, but there's a physical to mental connection that we probably also have to talk about?
Integrated healthcare. Integrated healthcare is what it's all about. When you suffer from mental, you suffer from physical. When you suffer from physical, you suffer from emotional. So it's that mental, physical, and then we have behavioral health programs. So we have this inclusive system that actually works to get you better acclimated in life.
Yeah. What are some of the sort of general challenges guys are facing these days? Things where we may say, I don't know if I should talk about this or not, but maybe we should. What are some of those
mental health issues, addiction and gambling problems, relationship issues. You also have race and discrimination issues. And some of the big ones now with everything that's going on in the economy, housing and financial insecurities.
Yeah. Those things I feel like can very easily spiral. They can sort of like a snowball go, that old snowball going downhill analogy where they just tend to pile on top of each other. How can we recognize when that little snowball is now growing into a big one?
When you feel yourself getting out of control emotionally and you have these stresses, the anxiety, the depression, the restlessness, the difficulty sleeping, the intense fears. We know depression comes with sadness and hopelessness, but it also manifests itself in anger and irritability and unnecessary risk-taking, and those things are mental health issues. That's when you need to learn how to cope.
Yeah. And for those who maybe don't see that in themselves, that behavior changing, I know we talk about how important it is to have a circle of folks that you can trust around you. Let's say I have a friend or a family member and I see that behavior changing. How do I approach them in a kind, respectful way?
You just go to them and, grab them by the hand and say, hey, can I talk to you for a second? I see some real challenges that are starting to take place within our relationship and within the relationship of the family. Can we sit down and talk about it for a few minutes?
Because you don't want people to get defensive, because then it's hard to communicate, right?
That's right.
So once again, I know you threw out some numbers for people. How can folks reach you, Geoffrey, and some of your colleagues at the Harris Center?
Best way to reach the Harris Center is 713-970-7000.
All right, and we're wishing all the dads out there too an early happy Father's Day. I know it's a tough time of year, and you know, we don't need to suffer in silence no matter what we say.
Not anymore. Come to the Harris Center.
Geoffrey, good to see you, my friend.
Thank you, brother.
Thanks again.